CHD, or congenital heart disease, is the most common birth defect, and it happens in almost 1% of children. But a diagnosis of congenital heart disease doesn't mean that a child can't go on to have a really wonderful life. Having a good team that knows exactly how to shepherd you through this journey is what will make you feel more confident. The management of congenital heart disease is really different depending on the specific kind of malformation of the heart. And so in some cases, that's just medical follow-up where we see you frequently in the clinic and you might need certain medications to help keep your circulation stable. And in other cases, that's as serious as needing open heart surgery. In addition to surgery, there are many other things that we use to manage congenital heart defects. That includes something like a CAT scan or an MRI. It's very frequent for children to need echocardiograms, which are ultrasounds of the heart, and for that to be something that they're getting a couple of times a year potentially to watch how the heart is changing over time. And then we also have the ability to do a cardiac catheterization, which is both a diagnostic test and an intervention that sometimes allows us to avoid surgery. The one thing that's common across all the different types of congenital heart disease is that you need lifelong follow-up with someone specially trained to manage that problem. So a cardiologist, both in childhood and then subsequently in adulthood. Children with congenital heart disease, just like children without congenital heart disease, will do the best in the long term if they're able to maintain healthy habits. And that includes a healthy diet and a vigorous activity level. We know that children with certain types of congenital heart disease are at increased risk for long-term challenges with their development, with their school performance, and with their mental health. And so we watch for those things very closely, and the American Academy of Pediatrics and the American Heart Association recommend doing formal screening and follow-up for those concerns. Today, we know that children with congenital heart disease have the potential to lead a completely normal life in the long term if they're surrounded by the right supports, the right doctors, caring family and friends, and making good choices that help them to be as healthy as they can be so that they can be productive, happy, and successful members of society in the long term.